Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
On today's episode, we're just going to answer a viewer question. My leg is swollen after my hip or knee replacement. Is this normal?
Good question.
Very common.
Not normal. Sorry to tell you.
Totally normal.
It's very, very common to have swelling after surgery of the lower extremity.
So people say to me, like, I had surgery on my hip. Why is my foot swollen?
Makes no sense.
Makes no sense. It's so far away.
It happens though. Whenever we do surgery or you have surgery, there's bleeding, okay? It's inevitable. There's going to be some bleeding. There's going to be some inflammation. And bleeding and inflammation results in fluid in that extremity. And because we live on Earth, gravity pulls the fluid down and boom, swelling down your leg.
Absolutely. And the other thing that I tell people is that if you notice when you wake up, swelling's not too bad. And then as the day goes on, gravity does exactly what Paul's talking about, pulls it down to your feet. And then the third thing is because you're not walking as much as you normally are, that fluid is not being kind of pumped back to your heart. So the muscles of your calves, every time you push your toes down onto the ground, it squeezes against the veins that have one-way valves and pushes that fluid back. So there's a tendency to pool.
And as we age, those one-way valves become a little bit incompetent.
Yes.
And they can't deal with the excess fluid as well. So it's harder to get that fluid back out of there.
What do you tell people to do?
Stand on your head for 6 hours a day. No.
Get one of those flip boards, those reverse incline boards.
No. While I tell people get up, move around as much as you can.
Yep.
And I'm a big fan of compression stockings.
Okay, yeah. You know who's not a big fan of compression stockings?
People who have to wear compression
Anyone
stockings.
that wears them.
They're very hard to put on.
Yes, and they're uncomfortable, but they work amazing. Or TED stockings, or like when you're even on the plane, a lot of people wear them. So if you can get those bad boys on, I think it's a great idea.
Get some help.
I think elevation is important for me. So not that you're being elevated all day, but if it does get swollen and starting to throb, then put it up for a little bit. It means maybe you're doing a little bit too much.
Yeah.
And then the other thing I tell people is ice.
Oh, that's a good one.
Yeah, I think if you can ice it, it's going to reduce some of the local swelling. I mean, if you have a total knee replacement and you ice your foot, it might not make a big difference, but you should ice the knee, and then there will end up being less fluid in your foot.
Here's a tricky thing I check for too. Let's say I operate on someone's right hip or right knee, and we're looking for swelling, and you're seeing swelling in the right leg. That makes sense, okay?
Yeah.
Now, let's say I'm examining my patient after they've had swelling in the right hip or right knee, and they have swelling in both ankles. Or
sympathetic swelling.
My sister had surgery, now my legs are swollen.
That's right.
No, it's a very important distinction now. If you've got swelling in both sides, that could be a more systemic sort of issue.
Yes.
Maybe you've got too much fluid on board, maybe your heart can't keep up and you can't pump the blood. Swelling in both ankles in the absence of any surgery can be an early sign of congestive heart failure.
Yep. Or maybe you have bad veins on both sides to start.
Bad veins on both sides. So if you have if your swelling is getting worse on both sides, you kind of want to check that out and make sure everything's going okay with the old pump. Make sure your heart is pumping everything appropriately.
And I'd say one other thing that I think is really important, if you have a really swollen leg after surgery, that's common, but if you have a really swollen leg and a very painful calf, this is a sign that you may have a blood clot, so a deep vein thrombosis. So when blood pools there, sometimes you can get a clot, and that clot can cause swelling and pain. So swelling without pain down in the lower leg is common. Swelling in the lower leg that's very painful is thankfully quite uncommon, but not impossible in the setting of a hip or knee replacement, and that needs to be investigated carefully.
Okay, so there you got it. Swelling in the limb after lower extremity surgery is common. Even after trauma in the lower extremity, it's common. Things to watch out for though, we want to make sure it's not a blood clot, which you'd have swelling in the calf and it would really hurt as well. Or swelling in both sides, that's sort of a lot worse than what you typically get. And of course, if there's a lot of redness, pain, fever, could be a sign of an infection. But the majority of the time, swelling in the lower extremity after surgery is common and just part of the healing process.
Last question, how long?
Everybody's different depending on those veins and depending on the valves. I honestly tell people it can be swollen for 6 months.
So do I. 3 to 6 months. Yes.
You know what I mean?
Yeah.
It can persist quite a while.
Yeah. So don't panic if a month later you're like, oh man, my leg's not getting. It's like improving, but it's still swollen. That would be very, very common.
Just put on some compression stockings.
Yeah. Walk it off.
There you go.
So if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.